the My Alliance newsletter to access that. So with that said, I am always excited to be on the webinar. I always love sharing information with you all and hearing from our speakers. And so I'm even more excited today because I get to tell you a few more things than I normally do. And I get to do it alongside my wonderful colleague, Mellissa Currie. And so I'm going to tell you some about her first, tell you a little bit about me, and then we will get started. Okay, so Mellissa is a licensed master of social work with 20 plus years of experience working with a diverse population of individuals, families, facilities, and groups. She is a graduate of Boise State University with an emphasis on well-being and mindfulness. Mellissa is passionate about ending the stigma associated with dementia, and she fosters a person-centered approach to finding unique strategies to complex challenges. So that makes her a really great social worker, if I do say so myself. Mellissa unwinds by gardening, traveling, crafting, and cat cuddles. So if you didn't already know, Mellissa was great. Now you do, and you're going to hear a bit more from her in a few moments. A few things about me. As you all know, I'm your weekly webinar host, so I get to visit with everybody who signs on with us every Thursday at this time. And it's been 7 months for me now that I've been doing that, and it's been a real gift and a real honor for me to share information about the ADRC with all of you. I am also a master level social worker, and I got my MSW from KU, of course, and I got my undergraduate degree in English from UMKC. And I love Kansas City, Missouri, and Kansas, but Los Angeles, California will always be my home. I've been in the Alzheimer's world for all of my career since 2001. I worked at the Alzheimer's Association for about 10 years. And that, incidentally, is where I first heard of and learned about the Family Series, which is our topic for today. And I have sort of mixed feelings about that. I'm super excited that the Family Series is around and that I get to tell you about it. I also hope that we are every day, one day closer to finding the cure and the prevention for Alzheimer's disease, so we can all find some more interesting things to do. So with that said, I think that's enough for now about me anyway, except for one more thing. I can't go on without saying hello to my mom, who has joined the webinar today. She has her camera on. Her name is Peggy G, and the G is for Grace, just like me. And she's the reason for me, so she's responsible for all of this. And you can take that however you like. Anyway, let's talk about the Family Series. We are super excited. The Family Series, like I said, has been a program for family caregivers since 2001, I know for sure. I believe this is the first time we've had it at the KU ADRC, and it's my great honor to be able to bring it to you. I want to share my screen for just a moment again. So give me a second to pull that back up, and we'll get you some information. Hopefully you can see that now. So the Family Series is a series of 4 this time around weekly gatherings. And it is designed for people who are caring for, who love, who are connected in some way with a family member who has Alzheimer's disease. So that can be your parent, your spouse, your grandparent, your auntie, your uncle, your third cousin, your neighbor, your church member, your sorority sister. I mean, if you have somebody that you care about, that you consider family, whether that's biological family or chosen family, then this series is for you. And we are going to be meeting on Thursdays, starting on next Thursday, July 13th, here at our location. And I have a slide coming up with the address in just a moment. And we're calling these gatherings. I don't want anybody to think that this is going to be a lecture or something really academic, or y'all know that I like to talk a lot, but it's going to be a conversation between me and whoever participates with us. The first week's topic is Help Me Understand. And so what we'll review in that first session is, what is Alzheimer's disease, which is something we are, all of us, I think, more familiar with than we ever wanted to be. But here's a chance for you to come and get some great factual, practical information, like what is Alzheimer's disease? What is the difference between Alzheimer's disease and dementia? Can you have one but not the other? Yes. what are the other kinds of dementias that exist? What kind of processes do healthcare professionals use to diagnose Alzheimer's disease? What should I be looking for if I'm concerned about a loved one with Alzheimer's disease? We'll talk a bit about medication and treatment and interventions with someone who has a diagnosis. We'll talk about conversations you can have with your healthcare professional. And we will talk about all of those things and more in every session. I'm going to do my level best to be on topic each session and talk about the dementia as an overview in the first session, but we certainly will not say no to any questions about dementia overview in any of the sessions. The following week, we will talk about behavior and communication, and many caregivers find themselves asking, why is he acting this way? And the short answer is because of a diagnosis of dementia. It's not intentional, not purposeful. No matter what your relationship was prior to the diagnosis, it's not intended to get on your nerves, even though sometimes it does. We want you to know that this is a safe space for you. It is okay to say, why is he or she or they acting this way? I'm having a hard time with it. I don't know what to do. I can't take this anymore is another common refrain we hear. So we'll talk about the behaviors that come along with a dementia diagnosis and ways we have to change our communication, and ways even that behavior is communication when someone has a dementia diagnosis. In the third session, we'll talk about, oh, she just sits around all day. And we'll talk about what do we do to keep our loved one engaged? How do we keep them busy? We will talk about why sometimes it feels kind of helpful that they just sit around all day. And that's okay too. We'll talk about things we can do all year long. Summertime might be a good time of year to get outside, depending on where you are and what your temperature is. I don't know if you all heard that this week, the world has broken the record for the hottest temperatures ever. The record was set on Monday, broken on Tuesday, equaled on Wednesday, and here we are Thursday. So it is hot, which might not mean we want to get outside, might increase agitation in some of our loved ones if we can't get outside or if temperature is just uncomfortable. So we'll talk about activities and suggestions. And then in our fourth session, we will answer to our best ability the question of, how do I keep doing this? Some of you are likely familiar with the book, The 36-Hour Day, which talks about how dementia is a long, involved disease for the person with the diagnosis and for the caregiver. And it can feel so long sometimes that every day feels like it's 36 instead of 24 hours. And dementia is, in many cases, a slow-moving disease. It doesn't appear overnight. It doesn't go away. And sometimes our family caregivers find themselves saying, I don't know how to go on. I don't think I can do this more. How do I keep doing this? And so we'll talk about some of those big feelings: grief, guilt, relief, respite, where to go, what to do next. So those are the things that we intend to cover. We are, of course, opening the sessions to whatever questions you have, and we will have lots of good information for you. In a lot of ways, the family series becomes something of a support group for the folks to attend. You can attend any one single session. You can attend 2, 3, or all 4. We've got a registration form online. We'd love for you to tell us in advance that you're coming so we can be prepared. So you can take that link down from this slide here. It's also in your My Alliance newsletter and will be in next week's and every week, probably until the family series concludes. If you find yourself not able to register, but you want to just show up, I will let you in, I promise. But it would be helpful if you do register in advance. We will be in the auditorium at our offices on Shawnee Mission Parkway, 4350 Shawnee Mission Parkway in Fairway. There's plenty of parking right out front. You won't have to worry about that. Just walk right on in, and I'll probably be standing there at the door to greet you, looking just like this, I promise. So feel free to come on in. Like I said, 1, 2, 3, or all 4 sessions. Tell your friends about it. Tell anybody you know who might need this additional support. Maybe they just found out about this diagnosis. Maybe it's been a long time and they need a refresher, or somewhere in between. So with that, that's the sneak peek, the sort of basics of the family series. And I want to make sure we have time for questions about that. But even more importantly, for right now, I'm going to turn over the reins to my colleague, Melissa, who is going to tell you about another program that really aligns very well with the family series, and that is called the Cognitive Care Network. So I'm going to go to the next slide, I think. That should happen. Yes. And Melissa, it's all yours, my friend.
Thank you, Kelly, and thank you for having me. And thank you, Peggy G, for the wonderful job you did. We all love Kelly. She's amazing and fantastic. So yes, so glad to meet you and have you both here. So the Cognitive Care Network, quite a mouthful to say. We also just call it our CCN. We are a team of social workers and a nurse. We work with numerous providers throughout the community. And we are housed here at the Alzheimer's Disease Research Center. So the University of Kansas Health System, we have our Cognitive Care Network, which is really just a program to work with families and individuals, whether it's a new diagnosis or existing diagnosis of memory loss, dementia, Alzheimer's disease. We really just want to ensure that people have the tools they need to focus on quality of life. I think a lot of times, she mentioned in my intro how I talk about we need to end the stigma when it's associated with Alzheimer's. You know, this is a medical diagnosis like many others, but of course it comes with unique complications. And what we want to do is make sure that people feel prepared and people feel supported. And so that's where we come in with the Cognitive Care Network, whether it's disease education, resources, connection, support, getting you connected to different various programs, which I'll talk a little bit more about in a bit throughout the community. Or honestly, I tell my families, I'm here for a listening ear. You do not have to do this alone, nor should you be expected to go through this alone, whether you're the person living with the disease or a loved one. So we are here and we want to support you. And that's where the basis of this program comes from. Next slide, please.
Yes, ma'am. Here it comes.
Thank
All right.
you. So how do I become a part of the Cognitive Care Network? As I mentioned, we have various physicians and facilities, clinics that we work with throughout the KC Metro as well as rural Kansas. But if you are connected with the KU Alzheimer's Disease Research Center and the KU Memory Clinic, you will be referred by one of your clinicians. They will, of course, talk with you about the program first to make sure you want to be referred. We're not going to cold call you or harass you or anything like that. Again, we understand that, you know, these appointments, especially if it's your first time, it can be very overwhelming. But we're here to support you through that. So you'll be referred to our team. Again, we're a team of social workers, all MSWs. We have some LSCSWs, which are licensed clinical social workers as well. And then we have a lovely nurse named Amy that's on our team as well. So a pretty broad range of individuals that you can connect with. And our clinicians know us and they know you. So after that appointment, we really do try our best to connect you with a cognitive care navigator that's going to suit your needs the best as well. We all have our own personalities as well as expertise in different areas. So we're working, behind the scenes to make sure we get you connected with the most appropriate fit as well. What is the Cognitive Care Network? It's a big question, but the reality is, again, we're a support here for you. Partnership of health providers, patients, and families working together to make sure you have optimal care and wellness strategies. So again, once diagnosed with mild cognitive impairment or dementia, you'll be partnered with one of us for that ongoing long-term support. We do follow you throughout your time at the clinic and sometimes even after. Education about your diagnosis. I've mentioned a couple of times how overwhelming it can be. A lot of families that I talk with are kind of like, what's the next step? What do I do now? And I find that as much as we might want to make a list and try to get everything done in the next few days, and what do I do? How do I navigate this? You know, the reality is, as Kelly had mentioned, this is a slow moving disease for the most part. It's okay to stop and take a breath. It's okay to talk with someone and get your bearings. Please do. We will help you navigate through that process and go through the next steps. But I don't want anyone thinking they have to make this huge list and go through it step by step. So that's a big piece of our goal in working together, is to prioritize. We can't do it all in one day. Rome wasn't built in a day, as they say. And so we can't navigate through this process in one day. Again, nor should we be expected to. Time to breathe, time to live, time to spend with your loved one and enjoy life. There's so many reasons to enjoy, yes, again, it can be overwhelming at these appointments, but, let's take things one step at a time. And so when everything feels a little fuzzy or chaotic, we're certainly here to try to narrow back down, make a game plan, and move forward. And that can include education about the diagnosis, not just for the person living with the disease, but their loved ones. And I love how, Kelly, you mentioned, we have family members that are biological, and we have our chosen family. Absolutely. When I say we work with families, I mean, who's your person? Who are your people? We want to find numerous people, and we want to get them all connected. We want to get everyone on the same page. And I think while we're all unique in our thoughts and our values and our ideals, at the end of the day, when we come together, we say, what's the common goal? And it's to support our loved one, to make sure that life is lived to the fullest, and that, again, we enjoy our time together while we are being proactive about trying to take on this disease and slow the process, and work towards the cure too, so holding hope in one hand, and then the reality of our next steps in the other. So education about the diagnosis is a big piece that we do early on, and of course throughout our work with families. Assistance connecting and coordinating your care across healthcare providers. That's advocacy. That's how I see that. Depending on where you're at, maybe your primary care provider needs some more education about your particular diagnosis or your loved ones, or maybe we need to talk with them about, the certain medications you're on, get them connected with your nursing staff at the memory clinic or our clinicians here. So think of us as a way to, hopefully as quickly as possible, I make no promises, try to navigate through all the ins and outs of those varying networks in which you are, getting your care through. Because again, like any medical diagnosis, many of us have other health issues and concerns that we're dealing with as well. And so, we have to be able to navigate through that as well. Support for emotional concerns and issues related to the diagnosis. Again, you're not alone. I tell my families, if you just need a listening ear, not every conversation has to be about what's my next step, what's that resource, what can I be doing? It is okay to say, I'm angry, I'm sad, I'm not feeling myself, I'm confused. I mean, whatever the emotion is, that can be a big part of the grief process. And we want you to be heard, and we want you to be supported. And that's what we're here for. Connecting you to those community resources like we discussed. I'm going to put a plug in. We, of course, have numerous support groups here through the ADRC. Mine in particular that I facilitate is for care partners of those living with mild cognitive impairment or early onset dementia. It's the fourth Mondays of each month from 2 to 3:30. I will drop a link in our chat but by the end, before we end here, so that you can connect to see all of the various support groups available. Support group can sound scary to people, but the reality is you don't even have to talk. You can come and just listen until you're comfortable. It's a safe space for people to connect and learn from one another. When we think about dementia, we think about memory loss. No two stories are ever the same, even if the diagnosis is the same. Everyone is an individual in this, and you're going to encounter things that maybe other families have experienced, maybe they haven't, maybe they will in the future, maybe they won't. The more that we can be prepared and share those success stories, as well as just normalizing what everyone's going through, that's what happens in those support groups. So come to my support group if it would be appropriate. And again, we have lots of other support groups available. And in fact, we're going to be getting together to by fall, we're hoping, or at least by the end of the year, to do a program specifically geared towards those who are younger onset Alzheimer's disease, that will be with their loved ones. So more of like a socialization group. It's exciting. We're excited about it, and we're working out the details right now. So do check back on our website, and that will be an in-person group. The group that I facilitate is virtual. We have both in-person and virtual. So attend if it's going to work for you. Providing brain health and wellness strategies. Like I mentioned, everyone's diagnosis, there can be different challenges and barriers that we face. So what are some ways to compensate, not just for those memory changes, but change the way that we communicate, change the way that we see day in, day out struggles, and again, make life just a little bit easier, a little less stressful. What are some ways to do that? And that starts with really knowing the person living with the disease as well as their loved one, a whole person-centered approach to someone, to know more about their life. Things are going to come up that it's going to be helpful for us to know. And that's another big piece with your cognitive care navigator, is getting to know you, getting to know your family. What makes you guys tick? Some of those things aren't going to change. And so how can we use that to our advantage? And what are some things we maybe need to avoid? So guiding families to develop a unified and informed approach to the diagnosis. I really already touched on this, but I think the biggest piece is, again, what's the common goal here? We're all going to have our different views. We're all going to be in a different state through our process of grief when it comes to a diagnosis like this. So again, how can we come together to prioritize our next steps and support each other? And then, of course, opportunities to be a part of the bigger cause. Access to cutting edge research programs. There's always a research program going on here. Please connect. You can check out our website. You can email us, whatever is the best way. The website always lists, I believe, Kelly, the most recent research, programs that are going on. It's a great way to find purpose, and it's a great way to, again, connect with others. What are some of the things we know that we can do to be proactive? Non-pharmacological approaches, exercise when appropriate, right? So one of the programs we have are DAP Fitness through the KU Sports Medicine Center, specifically designed for persons with mild cognitive impairment or early stage dementia, to have a personal trainer to work with them. I mean, how amazing is that? So we've got our DAP Fitness program, and I'll drop the link to the KU Sports Center here before we're done. The LEAP program, if you've been to another My Alliance, you've already heard about LEAP and how wonderful it is. But, understanding if we could change our diet, if we can just add in a little bit more lean protein or fish, how much that can help us. So again, there's a lot of different things that we can be doing. We recently worked with some volunteer agencies to make them more dementia capable and dementia friendly. That's our purpose project. Through, Harvesters is one of them, Scraps KC, but they did an amazing job working with us to those persons who are living with the dementia to be able to volunteer and give back to the community. Just because we have some cognitive challenges doesn't mean we can't still provide back to the community. And that's what we really wanted to foster. So lots of programs, always new things coming. We're here to support you in any way that we can. So I say all that just to remind that if you aren't sure what would be a good fit, talk with your cognitive care network navigator, connect with us. There's more than likely something that would be a start for a good fit for you. So.
All right. Melissa, there is a question in the chat that I think is timely for right now, if you don't mind. I'll read it out loud so everybody knows what it is. And it's from Mike. Mike says, my wife is the patient and I'm her care provider for her mild cognitive disorder with Lewy bodies. How is this, I think this must be the CCN, different from the support by the memory clinic doctors? She also has regular Zoom visits with Arlen, another wonderful colleague of ours. And is this a supplement to that support? Because, and I think we can all nod at this, we need all the support we can get.
Absolutely. So Mike, thank you for that question. Arlen is actually a cognitive care navigator. We often just introduce ourselves by our names or our title. Like I just say, I'm a social worker here, because again, when I've said cognitive care navigator out loud or cognitive care network, I have a tendency to just let it kind of run over in my mouth and spill out, and no one knows what I'm talking about. So you are connected with that cognitive care network through Arlen, which is wonderful. As far as extra supports, I would definitely recommend, we do have a specific virtual group for Lewy body dementia. And that will be in the link that I set in here in the chat. And then of course, my mild cognitive care group would be appropriate. You don't ever have to just pick one support group to go to. If you have the time and you need it, go to as many as is fitting for you. And talk with Arlen if there's other things that you guys are looking for. And then of course, another plug for the family series. There's always something to be learned from attending and connecting with others. So I would definitely recommend that if you're able to. And we got another question here from Renee. Very intrigued by the idea of volunteer opportunities with my loved one. Can you direct me to specific information about Scraps KC and harvesters? Yeah, Renee, I'm gonna have you email me so I can get that connected to you, because unfortunately I don't have a way to share a link to get to it at this time. I may at a later date, but I will put my email in the chat. So please, Renee, reach out to me and I will get that information to you. And Mike, you're awesome. So
Thanks, Mike. Thanks for the plug. Okay, let's see. Thank you, Peggy G. Mom. I have to say, Peggy G was a caregiver for my darling grandmother, Grace, for whom we are named, and she is also a nurse professionally. And so she has been a wonderful resource to our family, and I hope I have been the same for our family with my connection to the ADRC and the Alzheimer's Association. So I just really encourage everybody to use these resources that we're sharing today. Do not hesitate to ask questions, to come to the family series if you're available, to talk to the folks at the Cognitive Care Network, to do everything you can to give the support you need. Would like to know if we have any more questions or things you were hoping to hear today. Questions about the CCN or the family series are welcome. Mellissa does have a couple other things I want to show on the screen. This infographic is really a testament, I think, to the power of the CCN. I think Melissa's typing some things, so I'll take the privilege of telling you a little bit about this screen. It's amazing. The CCN in 2022 served 1,275 families, which is just absolutely remarkable, and 107 providers in the community. And I will say that we need more healthcare providers who serve an older adult population. I remember in social work school learning that Kansas is one of the oldest in terms of our demographics, one of the oldest states, and has the most quickly growing groups of older adults. An older adult is defined by the federal government as 60. So I didn't say that, that's just what the government says. So if you're 60 or more, you get to be an older adult. Cherish that, relish that, take advantage of all the great programs that are available to you, including the CCN as it applies. Nearly half of the referrals to the CCN were new diagnoses of a mild cognitive impairment or another early dementia. And one of the things we really, really are promoting at the ADRC is early detection. Some of you have seen, more than 700 of you have seen our film, Why, that talks about early detection and early diagnosis. And that is so important for quality of life and planning and reducing caregiver stress. That's part of what the CCN is. That's the goal of what the CCN is doing and what all of us are doing at the ADRC. I see the question in the chat about attending the family service, and you live across town in Liberty. We are not streaming the family series at this time, but I do want to encourage you and everyone to keep a track of our education calendar, which is what I linked to earlier in the chat. And you can find out when we are having virtual programming. And I don't know if we will ever do the family series in a virtual environment, but I'm in favor of virtual programming. So let me practice on this first group first in person, and then we'll see how it goes. And I think we certainly are open to traveling to other parts of the Kansas City metro, and dare I say, the state of Kansas and the state of Missouri to make sure you all have the information that you need. Okay, Melissa, are you still typing? Do you want me to say anything else about this infographic?
I think I'm done with that now. And no,
Okay.
I appreciate you going over that. We are growing this, I wonder, I'll be excited to see at the end of this year how many more numbers we have here with the Cognitive Care Network, and what this is showing, and what I hope that you're all seeing is just that we're out there, we're spreading the message, we're doing, everything we can to do that education piece and get everyone connected. And I see this as eliminating stigma in the best way we can. The more that we can foster open communication, and the more we can connect people, the better off we'll all be. So, and this just gives you a brief kind of overview map wise of all the places some of our community care CCNs travel to connect with people in these rural areas where, years ago, there may not have been that connection. And so this is continuing to grow too. This is the brainchild and the baby of Michelle Needens. And we just see, we've had Y showings in a lot of these areas as well. So, and like Kelly said, if you haven't had a chance to see that, just an amazing film. So just a brief overview.
I think this is our usual closing slide. So you can stay in touch with us, everyone, by emailing myalliance@kumc.edu. You can give us a call at the phone number on your screen. If you've got your My Alliance email from this week, you have information about the family series and my direct phone number and my email if you have questions about that you'd like to ask between now and next Thursday. So whatever you need, holler at us. Melissa, I don't know if you put your email in the chat yet, but feel free to do that if you would like. Next Thursday, we are going to be meeting on our webinar our new colleague, Harold Morales. And Harold is the recently hired community specialist program coordinator for the Alzheimer's Association, Heart of America chapter, our friends down the road from us in Prairie Village. And Harold is like me from Los Angeles. So Kansas City has figured out the secret here is to get all the good folks from Los Angeles to move to Kansas City. And they have us come in the summer before the winter comes. So we fall for it. Anyway, Harold is great. He's also a Spanish speaker like I am, and full of lots of great resources. So he will be talking with us on the webinar next week about some of the great programs that the Alzheimer's Association does and how we can really form an alliance together to serve all of you who are living with a diagnosis, loving someone with a diagnosis. So I hope you will join me to talk with Harold. He's a great guy and super excited to be with us. I think those are all the announcements I have for today. Thank you, Renee, for the, I'm going to presume LOL is laughing out loud. I always hope you all end this webinar with a smile. Thank you for joining us today. We knew folks would probably had other priorities this week with the holiday and the heat and all the good stuff. So we are always grateful that you take time out of your schedules to be with us on Thursday afternoons. So next Thursday, we'll have Harold from 2 to 2:30-ish. And then we'll have the family series starting at 4. So if I'm lucky enough to see some of you online and in person, I will consider that my great gift for the week. Thank you again to Melissa for